presentation. My name's Rachel Browner. I am with the OneOp team, and it's my pleasure to welcome you to today's session on Ready and Able, disaster preparedness for providers supporting people with disabilities. In case you're joining us for the first time, I'd like to give you just a brief tour of our webinar platform so you can find your way around. Hopefully, you're currently able to view the slides that we're sharing. If you're unable to see them or if you have any other technical difficulties, please reach out to us. Our address is contact@oneop.org for tech support, and I'll post that email address in the chat here shortly. As some of you've already done so, we look forward to having you join us in that chat pod for conversations and questions. To embed that chat pod so you don't miss any links or conversations, simply place your cursor over the shared slides. You'll then see a toolbar pop up across the bottom of your screen, and from there, just click that chat bubble icon. And when typing any questions or comments, please be sure to select everyone from the response options drop-down menu so everyone is able to view them in the chat. And then note that the slides and resources are available for download on the event page for today's session, which I'll again post in the chat here shortly. We're going to be covering continuing education information at the very end of the webinar. So if you are looking for those CEs and CE credits for today's webinar, stay tuned at the very end. I'll go over those and how you can access that information. And finally, closed captioning is available for this webinar. You can turn on the subtitles via the Zoom toolbar. And again, go ahead and keep posting where you're joining us from if you haven't already done so. It makes this platform a little bit more personable, allows us to get to know you, allows myself and the presenter and our colleagues. It looks like we have several folks from Texas. I've seen Southern California. I've even seen Alaska to Connecticut to Colorado. So I'm loving seeing where everyone is joining us from. North Carolina, Georgia, Oregon. Keep it coming. We enjoy seeing folks from all over, and we're happy to have you on this morning. And thank you for joining us as we continue our partnership with the Department of Defense and the U.S. Department of Agriculture to expand the readiness, knowledge, and networks of the professionals supporting our military service members and their families. The views expressed in this presentation do not necessarily reflect the official policy of the Department of Defense, U.S. Department of Agriculture, U.S. government, or OneOp, and the mention of any entity or product is for informational purposes only. I'd like to go ahead and introduce our presenter for today. We're very excited and happy to have on Ms. Logan Perks. Ms. Perks is the Regional Disability Integration Specialist for FEMA's Region 6, which includes the states of Arkansas, Louisiana, Oklahoma, Texas, and New Mexico. Ms. Perks has more than 15 years of experience helping people with disabilities live independently and have access to community services. She's worked for FEMA for over 3 years to make sure the needs of the people with disabilities are included before, during, and after disasters. She works with state and local emergency management agencies, disability organizations, and nonprofit organizations to achieve this goal. So without further ado, I'd like to turn over the presenter reins to Ms. Logan Perks.
Thank you. Thank you so much, Rachel and OneOp, for having me here this morning. I appreciate it. Okay, I do see the presenter now. So again, my name is Logan Perks and I work for FEMA. I'm the Regional Disability Integration Specialist. I am based in Texas, and so you're going to hear me reference Texas a lot. And many of you live in Texas, so you know that we like to talk about Texas a lot. It's a very Texas thing. And so my presentation, again, is called Ready and Able, Disaster Preparedness for Providers Supporting People with Disabilities. So I'll just give a brief overview of what you can expect from this training today. I'm going to talk about what disability integration is. I know that's not a common thing at many organizations. And then I'll briefly explain FEMA. I know not everyone is familiar with it. And then I'll get into the meat of the presentation, emergency preparedness for caregivers. So most of it covers, every step that you should go through to get prepared and the resources you're going to need to do that. And then we'll have some interactive scenarios where you can participate in the chat and then have a recap where you can ask me questions. So I can tell y'all are already really interactive. So I'm excited for this training today. And I will go ahead and get started. So disability integration, it happened at FEMA. It was created after Hurricane Katrina, which some of you may remember, but it was 20 years ago. And so it was basically very tragic for those of you who remember Storm and Katrina and 70, excuse me, 71% of the fatalities in Louisiana were people over 60, and many of those had disabilities. So there were widespread reports of evacuation buses without wheelchair ramps, inaccessible shelters, and just a general lack of inclusive planning by first responders, local and state jurisdictions, and FEMA as well. So FEMA made changes to improve our programs and provide support to local jurisdictions and disability organizations to help prevent this type of situation from happening again. And if you look at the slides, there are a couple specific laws that are the foundation for disability integration that you can see there. But basically, we just want to make sure that everyone can have access to FEMA programs. And we believe that disability integration at FEMA benefits the whole community because when you make improvements for people with disabilities, it helps everybody. So now I'll briefly talk about the role of FEMA. As our slogan is, helping people before, during, and after disasters. And FEMA stands for Federal Emergency Management Agency. We follow the approach that disasters are locally managed, state-led, and federally supported. So when there's a disaster in your community, like a wildfire, a tornado, or a winter storm, it's going to be your first responders and emergency management agencies will be the people you see providing the help. It's going to be large disasters that are presidentially approved, where FEMA comes in later to provide resources and financial support. So now I'll get into emergency preparedness for caregivers, providers, and these are the practical tips. And so the first one, I think it's the most important, and it's also the easiest for people to do. So that's also really convenient. And it's to get notified. So I always emphasize this step as the most important one because it's literally your life and safety that depends on it. The people I talked to in the community that were completely caught off guard by major hurricanes or flooding, they didn't have emergency alerts set up on their phones. So I always recommend local alerts as the most important ones to sign up for because it's going to be your local government who has the most specific information about the weather. And also they can tell you what to do in an emergency. So local governments, they may have an evacuation order. They may offer resources like water if there's a problem with the water treatment center and it gets shut down. So really the most important thing you can do after this training is to look up how to sign up for your local alerts. And unfortunately, there's not one place that you can go to sign up since everything is localized. So you just have to search on the internet with your city or county an emergency alert, and see how to sign up for your local alerts. That way you can get the best information there for you and your care recipient to stay safe and stay informed. So we also learned, though, from this past flooding event over the summer in Texas, that cell phones don't always work. Even if you have one, you don't have a cell signal. If it's a rural area, or sometimes the actual storm can knock out a cell signal. So that's why we also recommend what we call a NOAA weather radio. If you're a provider agency, that would be a great part of an emergency communication plan, because a NOAA weather radio is battery operated. So if there's a power outage, you can still get access to emergency information. So a NOAA weather radio is a really helpful thing to have, and you can see how to purchase those online as well. So now I'm going to go over the FEMA app, and you can see the graphic on this slide is a hand holding a cell phone with our FEMA app. And the reason I really like the FEMA app is not just because I work for FEMA, it's because it's designed to be accessible for people with disabilities. It's good for people with intellectual disabilities who may be deaf or hard of hearing, who have low vision or blindness, and really anything. And the reason why it's helpful is because it uses photos and simple language to communicate important information. It's also compatible with screen readers and voice commands, and it has an intuitive interface that's helpful for all users. So another thing that I like about it is you can sign up for weather alerts from multiple locations. So if your care recipient lives in a different zip code, or you just have friends or family members that you want to make sure that they're safe, you can sign up for alerts for their zip codes in different states, in different areas of the country. So that's another reason why the FEMA app is really helpful to have for weather alerts. And so I always recommend it. And then also just keep in mind that most cell phones have accessible alerting systems. And so when people turn the accessible features on their cell phones, it's going to apply to the alert systems that they have. And just don't turn the alerting systems off in your cell phones, because those are important. And so now I'm going to talk about understanding emergency messaging, because it's obviously great to receive the emergency messaging, but you also need to understand what they mean. So here's a graphic and you may have seen this messaging before, heard it, gotten it on your phone. So on one side, there is a house that has heavy rain all around it and some pooling water around the house. And it says flood watch. And that means flooding is possible. It says stay tuned to radio, TV for information, and be ready to move to higher ground. So whenever you get an alert, that means it's something serious. It's not just your regular rainfall. It's not just your regular winter storm or some kind of heat wave, a regular event in weather. They're very cautious about sending out alerts. They don't want to always send them, and then people don't take them seriously. So a watch does not mean go look out your window and enjoy the nice scenery. It means it's something serious. So when you get a watch, definitely pay attention. But then on the other side of this graphic, it shows flood warning, and the image shows the same house, but with more severe rain coming down, and the water is pooling up all around the house, covering parts of the door and the garage door. And so a warning means something is happening at that moment or will happen soon. And it says move to high ground immediately. So when you get an alert that says warning, that means you need to take immediate action. So I know sometimes people think warning is like, oh, like when you're a kid and your mom gives you a warning that it's you still have time to act. They don't take it super seriously. But in emergency management, a warning is the most serious alert that you can get. So people need to know that and understand that. I know it's not the same type of way that we use warning in our everyday language. So if you see an alert that says warning, take immediate action and be ready for that. And then also, it's not enough just to get these messages, but you need to follow them. So whenever your local emergency managers, city government tell you to do something, follow what they're telling you to do. So this slide is about paying attention to your surroundings. So we all live in different environments, all the people that are attending this training, but we all also move around, maybe for school, work. So we may have moved somewhere we're not all as familiar with. So we all experience seasons, natural hazards, climate. So one slide has someone digging their car out of snow. I don't really experience that in Texas. And then here's an image of a house getting blown away by a tornado. I've never really experienced that either, but I certainly experienced the extreme heat in the last graphic and someone drinking water. So an extreme heat doesn't just happen in the summer here. It happens in the spring, it happens in the fall. So you have to know what climate you live in and what your hazards are going to be where you live. So, and there's some people from all over here, like Alaska, been wanting to go there. So, Alaska, you don't have to worry so much about extreme heat. If someone's from Arizona, that's definitely something they have to plan for. So, you just have to know what you're going to have. Like New Mexico has to worry about a monsoon, Missouri tornadoes. But the good thing is, if you practice or learn about sheltering in place or evacuating, you can apply those to the different hazards that you have in your community. Even when you move, it'll just depend on whichever thing you're experiencing. And again, always remember that whichever disasters that you may experience in your local community, most likely it will get handled first on the individual, local, territorial, state, or tribal level. So now I'm going to start getting into some of the caregiver specific information for you. And this one has a lot of text. So I'll give you a second to kind of look at it on your own before I discuss it. So I know many of you here for this training and this webinar, you're paid caregivers. I think some of you are also family or unpaid caregivers. And so it's really important for you to have an official plan that you can either submit to a licensing agency or something, your boss, your director of your agency, to show that you've discussed these things, so you know how important this is, and you know that you have a part to play in your care recipients' individual preparedness, and also your agency has a part to play in coming up with a plan for what they would do in an emergency. So, your best resource for you, for those who are paid caregivers, is your employer because they're going to be able to tell you exactly what they expect from you, what information they want you to find out, what kind of plan they want you to provide. So, and they'll also know what the resources are exactly that your agency is able to offer. So, step one, I would always say talk to your own supervisor, talk to your own agency, and find out what kind of role they want you to have, what paperwork you need to submit. So, that's the first place to go. But of course, part of your plan for your care recipient should include you and what would happen if they're unable to receive assistance from you. Because ideally, you would be able to help in any type of emergency situation. But you don't live there 24 hours a day unless you are a family caregiver, then you might live there 24 hours a day. Um, but you have to plan for what would happen when you're not there. And so you should have a backup plan for what happens to my care recipient when I'm not working there. And this happened in the Texas winter storms about 4 or 5 years ago when the power grid went down and the streets weren't really passable because there was ice on the roads. So there were care recipients who were separated from their caregivers for at least a few days. And so the care recipients had to figure out how to get the care that they needed. So either family members or neighbors had to provide that level of assistance, or they had to try and do it on their own. So having that discussion before anything happens is also really important. And that's also why individual preparedness for yourself as a caregiver is important, because if you take care of yourself, that will help you be able to take care of other people. And then you also just want to maintain your own safety. And so, something we also emphasize at FEMA is including people with disabilities in the process as a priority. So, at every stage that you can, even with your agency plan, include the person with a disability in that planning stage.
Logan, as you're talking about some of these guides for our providers on, because that's predominantly who is on today's webinar, is a lot of providers that are working with families.
Mhm.
So as their agencies think about how they can better support caregivers, and you talk about the guides, do you at some point in the presentation get to examples of these guides, or is there an example on the FEMA websites where they can find these guides or helpful examples?
Yes, so I have coming up a list of where you can get examples. So from states and there's caregiver websites that have it. It's just too much detail to go into in the presentation. And when I get to that, I'll explain uh, how how you can kind of sort through that information and decide which would be most appropriate for you to use. So I will
Okay.
get to that.
Okay, thank you. And for those that are on, feel free to ask any questions in the chat for Logan. We'll get those relayed to her, even some comments that you may have. And then also at the very end, we'll go over some more questions and comments as well.
So this, and I know that I'm covering information that assumes you have somewhat of a base of knowledge, but I'll provide you the resources to get that base of knowledge a couple slides later. It just, emergency management is a very large topic. And so I don't want to spend all the time just giving you guys basics. Uh, so this slide is draft a plan with shared responsibilities. And so if you want to take a look at this one, I have it separated what the caregiver recipient, what their portion of drafting a plan would be like a formal plan. And then on the right hand side, what a caregiver would be responsible for, ideally in this process of creating a plan. So for this one, I mentioned before, you always want to include the care recipient and their family in any formal plan development process, because this will create buy-in and encourage self-advocacy, and they can help problem solve. Like for example, if you discuss what you would do in a power outage, the care recipient and their family, they may know about a neighbor who has backup generators who would let them stay with them during an emergency. Or they may know people who would be able to provide transportation and help them evacuate. And then having an official written plan with clearly delegated responsibilities will just create less stress and confusion during a disaster. And having a formal plan may satisfy any legal requirements your organization has. And so I'll give you the links for that in, I think, the next slide. And it's also helpful to have on hand for any newer staff that come in. It's a document that people can refer to in the future. It provides concrete steps to meet the specific needs of a care recipient. It's just a really good thing to have on hand. It will determine if doctors or treatment teams are needed to be included in emergency plans for any possible acute care needs if there was a disaster. So here's some examples, things that you would consider after you're drafting or as you're drafting a plan. So these are a few questions, and I'll explain some of the things on here you may not be familiar with. So I talk about, are there any charging centers? So sometimes when there's a power outage, local emergency management agencies, first responders will set up something called a charging center. So that's a place people can go to charge like wheelchair batteries or things that may be life sustaining for people with disabilities. So the way you would find out about it would be something we would cover later, which is by getting plugged into local emergency managers, shelters. So you could potentially go there. Usually they're providing other services at the charging center as well. Like it may be a cooling center when it's extreme heat. So it could be somewhere like a fire department where you could go with your care recipient and use their generator to recharge any equipment that you need. So these are just questions that get you thinking about what you would do in an emergency. Things like accessible sheltering. Is electricity needed for anything life sustaining? So, something to think about that FEMA doesn't really get involved in because it's not a specific event, but it's extreme heat. So, the Center for Disease Control reported there are about 1,700 deaths from heat in 2022, and many other sources think it was much higher. And so, if you live in an area with extreme heat or an area where people aren't used to heat or don't have air conditioning in their home, then you might want to include that in your plan of How would you handle that for your care recipient? Because some people may rely on refrigeration for medication, for insulin, or people with disabilities may just be more sensitive to the heat. So those are the types of questions, and these plans that are available do have prompts that would cover things like that. So this is the list that provides the resources. So it says get prepared by using free resources. So I start with ready.gov, which is run by FEMA, and we have a specific website dedicated to people with disabilities. And this one covers a lot of individual preparedness. And so this really teaches people about things like creating the go bag. So if someone had to evacuate quickly, it helps create the checklist of what items would they need because of their disability, like medications, durable medical equipment, things like that. So that's a good place to start. And then going down, it gets a little more detailed and based more on being a provider, a caregiver. The top ones are about caregivers, some of them are family, some of them are specific to paid caregivers. And then we have one that's home care hospice providers. And then at the bottom, there's some that may or may not be applicable to your agency about what the requirements are for agencies that receive federal funding. So again, I'm not an expert in what your agency is required to follow. So I just provided these as resources. So your state licensing agencies should be able to tell you. If you're not sure, but you're licensed in your state, you've never done this before, they would be a good resource for you to contact. But an example of one of the free resources is on the left. Here's a list that can get you started. Yes. So I see a question about the links if they're clickable. They should be clickable. In my PowerPoint, they were clickable. I know that they transferred it to a PDF. So if it's not clickable, you can let me know. My contact information will be at the end of the slide. Uh, but on this fillable emergency preparedness checklist on the left, it has prompting questions like things like what are the early warning signs that my care recipient is having a lot of anxiety and stress during an emergency event? What are ways I can manage the challenging behaviors my care recipient might show? And this list came from one geared toward veterans, so it's targeted for someone who may have PTSD. So there's really a guide, a list for many different types of disabilities, tips for dementia. I don't think you'll find that there's a shortage of resources out there. So that's a really good thing. And they're all free. So hopefully this will make you feel more at ease and answer your questions. But that's why I don't have enough time to review all of the specific resources with you. So you're gonna have to do homework and kind of click through these on your own. But hopefully that answers your question about some of those resources. So they cover, like I said, individual preparedness, creating a go bag, provider preparedness, policy, and resources. So now I'm going to talk about the local resources that are available to you, and this should apply to every city, state, county, parish, territory that you all come from. So you need to get familiar with the local resources available for you and your care recipient because, like I said, they're the front line of the people that will help you in any type of disaster, emergency, small, medium size, large, both individual and as an agency. And so they're, I think, more available than people think. And usually they really want to talk to you because it also helps them be prepared. So the first one I talk about are the first responders and the city and county or parish emergency management agencies. So to find out who those are in your area, usually you can just look up their website and it's either on the city or county website. If for some reason a separate emergency management agency office or person isn't listed, you can just call your city and ask if they have someone. So when you reach out to them, you can explain what your situation is, that you're a caregiver, what the needs of your care recipient are, what your concerns are, what you feel like, what what might need to happen for your care recipient to receive assistance. For example, if you're most concerned about transportation, then that's something you could discuss. Or if you're concerned about accessible shelters, then that's something you could discuss. Most of the time, the cities already have the shelters pre-identified that they would use in a disaster. So they would be able to tell you what those are and they can have that discussion with you. So that's really going to be your best resource, I think, for a local resource. But I also let people know that for some peace of mind, that the American Red Cross, which manages a lot of the shelters throughout the US, and I'm not sure about the territories, but they have volunteers who have been trained on assisting people with disabilities. And so they're able to provide excellent services for people with disabilities who go into shelters. So they're a good resource. And then also just speak with every provider that your care recipient receives help from and ask them what their plan is. If your care recipient gets dialysis or memory care treatment, then ask them what would happen if there was a disruption in their treatment and see if they have a plan because they might be required by their licensing agency or by statute to have a plan. And then you can incorporate their plan into your plan. Or if they don't have a plan, then maybe you all can brainstorm and create one together and create some kind of continuity of care. So the last thing I'll mention so that we have time for the activities is that there are some regional or state disability registries. And so those are registries where people with disabilities can sign up to get extra assistance in emergency situations. So not every state has one, not every area. I don't know about the territories, if any of them have them. Um, so you'll need to look that up on your own and verify also the level of assistance being offered. And always keep in mind that the registries usually don't guarantee help in any kind of emergency because they also can't predict what will happen, what their resources will be able to guarantee assistance. So that's why it's so important that people with disabilities and their caregivers have their own plans in place.
Logan, we had a few questions that came through, and I'm hoping you can kind of address them here, especially as we talk about resources.
Mhm.
With regards to the FEMA app, Would the app allow an individual to geographically limit the alerts that they can get? Um, I think some of the concern is people don't want to get alerts, which is likely to happen maybe 2 states away. Is the FEMA app where you can geographically limit the alerts that you receive?
Yes, yeah. You put in your zip code. So if you only want to receive alert for your zip, it's not like a default national alert system. The weather alerts are based on your location. You can just add additional locations if you want to receive more alerts, but the weather alerts are only for your location.
Okay, thank you. And what would you recommend for someone who might be legally blind as far as resources and reaching out and connecting with different agencies?
Sure. Well, so I have on the local resources too, like the Centers for Independent Living, but a lot of the blind organizations, I've worked with them. A lot of organizations get involved in emergency management. So I've worked with some chapter branches of the National Federation for the Blind. So if this is a topic that interests you, I would say you can discuss it with any blind organizations you're involved in and see if they've ever worked with any emergency management agencies on this topic. I know the state of Arkansas as well has had some representatives from the Arkansas state chapter of the National Federation of the Blind get involved when there's been federally declared disasters to make sure that people who are blind have access to the information that FEMA is putting out. But in terms of just getting the alerts and information like that, I do recommend the FEMA app, but also, there's other apps, the Red Cross app. I was Googling, like if you Google search online which apps are best for blind, low vision, there were ones that came up. I just didn't want to list every single possible app for time's sake. But there are a lot of resources, and I will have my email at the end of this presentation. So anyone can feel free to reach out to me via email as well, and I can offer more guidance.
And Logan, is FEMA accessibility mandated by statute or covered under ADA?
So generally, we follow the Rehabilitation Act because that covers federal entities. And it's similar to the Americans with Disabilities Act, but the Rehabilitation Act, I think, was from 1975. Um, but yeah, so it's very similar to the Americans with Disabilities Act. But yes, it is required by law that we provide accessibility for people with disabilities.
Thank you. And I won't go into them too far, but a few people made some great recommendations or resources that they shared, reiterating the Red Cross as an excellent resource. And then Stacy mentioned um, working with different organizations and local fire departments was helpful for their area and businesses. So just wanted to shout out to Stacy and Chris for providing those nice comments about resources that helped them. Okay, we'll let you keep going now, Logan. Thank you.
Okay. Well, in the interest of time, these are my two scenarios, but I'll skip the power outage one because we've covered that quite a bit. And I'll go into this flooding scenario. And so if you just want to put in the chat what your thoughts would be, and I'll read it out loud. So it's just thinking as a provider, as an individual, based on some of what we've said. I know this is potentially a new topic for many of you, but some of it can kind of be common sense. That's what I like about emergency management is common sense applies a lot. But I'll read the scenario and then you can start typing in the chat what you think you should do, the residential group home should consider doing, questions you have. So, the residential group home for children with disabilities is situated near a river and heavy, possibly historic rains are expected. Cell reception can be spotty. Most of the children have mobility disabilities and use durable medical equipment. There are not enough vehicles for all the children to evacuate at one time. What should the residential group home consider doing? So, if you worked at this residential group home and this incident was going to happen, what are the types of things that you would think about needing to do? Okay, moving to higher ground. So that sounds like evacuate, plan ahead and evacuate. Start evacuating now. Okay, need to have a radio to make sure they can receive alerts. Yeah, I think that one's a good one. Any other ideas? Early evacuation app on all their phones, go bags. Radio, have a plan in place and partner with local entities. Okay, yeah, wow, you guys are good. Creating an internal list of all DMEs needed by residents to ensure if anything is left behind. Okay, yeah, have a plan, some kind of evacuation plan. Purchasing a boat to relocate. Okay, a boat might be kind of scary. So yeah, hopefully there's an evacuation plan that was already in place. Gas up vehicles and park them at higher ground in the event evacuation is necessary and unable to do so before the event. During tornado season, we always had a go bag with water and snacks for shelter. Proper evacuation plan. Okay, yeah, walkie talkie. Okay, yeah, there's a lot of good suggestions here. Anyone else want to add things? Okay, airlift evacuation plan. Okay, so we want to keep in mind that airlift does put a huge strain on local first responders. So ideally, if we have plans in place, we don't have to do airlift. So it is a good emergency measure to have. Um, but ideally, people that are have planned ahead of time don't have to rely on airlift. So something I don't think people have said yet that you might want to consider is since they don't have enough vehicles and it's a group home, a lot of times group homes have more than one facility or they know other group homes, so they may want to have some kind of agreement with other group homes where they could borrow their vehicles or other group homes could help them evacuate if the other group homes are in safe areas. So that might be part of an evacuation plan that they have. Um, but I like what Jake said about having an internal list of all the DMEs needed by resident to try and take them with them if that's an option. But yeah, I think ideally evacuate as soon as possible. The old better safe than sorry. Yeah, someone put also maybe the local school district for buses. So all of this shows the need for having a plan in place. So I am going to say a boat isn't the best idea, especially on like a river where a boat is similar to an airlift where it's a last resort because someone didn't have a good plan. Let me see. Yeah, so Terrell wrote early evacuation for as many trips as necessary. Yeah, and if you start evacuating early, not having enough vehicles is workable because you can do multiple trips. So they should also think about where are they going to take these children. So if they have more facilities, they could take them to other facilities, or they can have a spot arranged with the local city or other providers may have room for them. They could go to an accessible shelter that would be set up. So you can tell this would involve coordination, communication with an already established relationship with local government. So ideally, all of this would have happened well before any type of storm weather incident. And someone had said as well, they mentioned the NOAA radio. So I think that's really important because we don't know if, it said cell reception was spotty. We want to make sure they have the most accurate weather information to make decisions. So having that NOAA radio, especially when you're a facility and people live with you, they're completely reliant on your judgment. Having a NOAA radio, I think, is essential. So, but you guys all gave really good answers. So, thank you for your participation. And I'm going to go ahead and just do, it looks like there's also the ham radio operators. So they're good people to know, like you said, and they don't require a cellular signal. They can communicate with each other without a signal. So I'm gonna I skipped the recap. So I'm gonna keep the recap really short. It's just I hope you've learned from this training that emergency preparedness involves a lot of people. It includes the care recipient, you, providers, family members, local emergency management agencies, first responders, and maybe even neighbors. So it's essential to start having those conversations well before any disaster or emergency. And also, hopefully, you've learned that there may be legal or statutory or licensing requirements. And so you need to learn what those are. And also, don't forget to include the care recipient in the planning and try and test the plan through detailed scenario discussions or drills. So, what I mean by test the plan is just kind of what we just did, where if you talk it through either with your care recipient or coworkers or anyone, just think about how would it work in real life. So that's always a helpful thing to do. I don't know if we have time for maybe one or two more questions before I turn it over to Rachel. And then my email is after the question slide.
Okay. Well, Logan, if we want to go to the your email address, then we can put that up on the screen here. So if anyone does have any questions, don't hesitate. Go ahead and type those in the chat. If you're thinking about some questions for Logan, we'll go ahead and put up the slide where it has your contact information, though, so folks can see that. Also, just to reiterate, you can access Logan's email and contact information, all the resources that she mentioned on the PowerPoint slides, and I went ahead and posted the link to the event page. So that event page, you're going to have different sections in that event page. You might have to refresh your web browser, but you're going to be able to find a section that has event materials. You're going to see another section that says continuing education. The continuing education I'll go over here shortly, but the event materials, you can download those PowerPoint slides from there as well. So you can have access to that for your records. I'd like to, I'm not seeing any questions come through, so if I can, I'd like to go ahead and touch on the CEs real quickly, because I know we're getting to the top of the hour. We have several continuing education opportunities for providers on today, or those that are just needing a certificate of attendance to provide to your supervisors. That option is available as well. But any patient advocates, case managers, disability management specialist, family and consumer sciences, certified family life educators, our health education specialists, and then our social workers, our licensed professional counselors, our licensed marriage and family therapists. We have CE offerings for all of you. What you'll need to do though is you will need to complete a survey. You will complete a survey that will then take you to another page, and this is an online survey that you'll complete, and then you'll identify which CE option that you're interested in. You should be able to receive an automatically generated email certificate. Now, the event page, the link to the survey is already posted on that event page. You're going to see a purple Continue Education button on our event page. You're going to refresh your web browser so that purple button will appear. Go ahead and refresh your web browser. There's a purple Continue Education button. But also, let me see if I can go ahead and get it posted here for you. Here is a direct link to our survey that you can use to receive an automatically generated email certificate for today's presentation. If you have any questions regarding accessing CE credits, if you feel like you've done all the steps in the survey and you're still not getting your certificate, reach out to me. I'm going to go ahead and post my email address in the chat as well. Feel free to reach out to me. I'll try and help you as best I can with getting those certificates to you so you can get CE credit for today's session. Or if you have any additional questions about today's topics or future programs, feel free to reach out. I'm happy to help in any way I can. I'd also like to just direct your attention to a couple events coming out in 2026. I can't believe that we are already at the end of the year. This is actually one of the last programs for our OneOp team for the year for 2025. But stay tuned. 2026, we already have a couple of some great programs coming out. We're going to be focusing on a little bit of a different program instead of your normal webinar that you see here. We're going to be providing a direct learning opportunity focused on Medicare, made simple for caregivers and providers and what you need to know. And so it's going to be an online, on-demand learning session that really provides an overview of Medicare. You can hop on at any time. It's going to come out January 15th. You don't have to be on it the day of, but you can also go back after it hits January 15th to our website and access that information at any point. It's going to be a little bit of a different format. We thought it would be kind of fun to bring you something different than our normal webinars. But we're still going to be here for our monthly professional development webinar. So in February, we're going to be looking at, and if we can go to the next slide, we're going to have a webinar nutrition considerations for IEP and 504 plans for individuals with disabilities. That's going to be February 4th. And that webinar will actually be provided by a dietitian and a military connected provider who's going to highlight some common conditions that may have nutrition accommodation components to it. So thinking about nutrition-specific accommodations by educational phases, so elementary, middle school, high school level, to support mealtime and support school environments. So mark your calendar for that event as well. I'll go ahead and post those here in the chat as well. I apologize for all the overwhelming links in the chat, but mark your calendar, get connected with us for some upcoming events in 2026. But before we hit 2026, I just want to wish everyone a happy holiday and a safe holiday, whether you are um, experiencing lots of winter weather or if your winter holiday is going to be a little bit on the warmer side. We hope that you have a wonderful Christmas with family and friends and a safe holiday season. So, thank you for joining us today. We're going to stay on for about one more minute. And so you can gather any last minute resources or if you have any quick questions for us. Thank you, Logan and FEMA, for today's presentation and providing lots of good content for us, especially on the basics of disaster preparedness for individuals with disabilities. So thank you so much. Have a wonderful rest of your day.